When describing the HIV and AIDS epidemic in Botswana, President Festus Mogae said that we are threatened with extinction. People are dying in chillingly high numbers. It is a crisis of the first magnitude. This goes to show how terrible the healthcare in Africa is, especially before the use of mobile health. Mobile technology is an effective solution to the healthcare problem in Africa through its ability to allow faster and easier communication, as well as having easier access to information. The use of cell phones enables people to more easily access the medical information that they need, such as learning about certain illnesses and how to treat them. Cell phones don't just deliver information, they also enable people to have a camera, computer, and connectivity. This gives the people the ability to obtain a piece of cheap, portable healthcare equipment. Before mobile technology was used in Africa, it was hard and sometimes close to impossible to access the medical information and the care that people needed. Simple medical needs such as getting a vaccination or checkups were hard to get and sometimes inaccessible. For instance, in the rural countryside, there are fewer hospitals and doctors, so it was difficult to get vaccinated or schedule an appointment. The travel into the cities from the countryside was longer and more challenging. Through the free text message system MXit, African mobile users are able to get basic information, ask questions, and get general counseling from certified doctors. This allows Africans to get quicker access to healthcare information, and it allows them to be educated about different medical issues that they may be dealing with in their everyday lives. Cell phones enable patients and doctors to more easily communicate with each other. In Kenya, for instance, the rural areas don't have specialists, so the doctors there send the symptoms and images of their patients to the experts and specialists in the cities. This allows the doctors in the rural areas to easily consult with the doctors in the cities. The use of cell phones allow the people in more remote and rural areas of Africa to gain access to the kind of health care that the people in the cities have. This allows patients to avoid the long journey into the city, and it improves their quality of local health care. With cell phones, doctors in different villages and in different countries can contact each other about current issues. For instance, in Uganda, epidemiologists and disease control specialists were able to send out text messages about outbreaks of tuberculosis, severe acute respiratory syndrome, and Ebola. The use of phones allows for the information to spread more quickly and effectively by notifying the healthcare authorities and the more at-risk villages. Informing people of this knowledge is important in the prevention of diseases spreading because outbreaks in areas such as Africa with poor healthcare can be fatal. A huge population of Africa is affected by HIV and AIDS. It is the #1 most destructive disease that is tearing apart large areas of Africa. For example, the life expectancy in Botswana is 53 years due to HIV and AIDS. It greatly harms the people that it affects by causing them to more easily catch diseases, and it increases their risk of dying from them. Mobile health care is helping those affected by educating them about AIDS and HIV and getting them the medical attention that they need. They help the people get tested and treated properly. The project known as Project Masaluki, or Project M, was created as an HIV and AIDS support and awareness network. It is driven by text message communication. Project M actually means to lend a helping hand in Zulu, which is exactly what it is doing. Project M uses mobile technology to encourage the use of at-home testing and to guide people through the process of at-home testing and treating. The project also educates people about the things that they should do to treat AIDS and how to prevent it. The project was started by sending a mass text message to 1 million phones to encourage people to be tested and treated for AIDS and HIV. It has inspired many people to reach out for the help they needed. This led to the number of people who called the National AIDS Helpline to triple. The project also sends out reminder text messages to HIV patients to take their antiviral medication. Staff at a hospital text patients to make sure they're taking their medication at the right times and in the right way. AIDS can be sustained by taking antiviral drugs, but it is only effective if they're taken every day. If they are not taken, the full effects of AIDS can come out. This type of text message communication allows the medical care to be more effective and it ensures that the patients are not incorrectly taking their medication. This shows how mobile technology can be used to drastically change the lives of AIDS victims through allowing easier and faster communication and accessing medical information. Another major issue in Africa is labor and childbirth. With the low health care that Africa has, there higher the chance that the mother and child could die. Women in Africa expect there to be something wrong with their baby. For instance, a nurse said that it was horrifying to be pregnant. Mothers used to bleed to death while waiting in their homes, hoping a healthcare worker would come to help them. If a woman in the rural countryside goes into labor, it is very difficult to let a doctor know because they have no way of contacting them. It is also very difficult to go into the city where most of the doctors are, not to mention the lack of necessary medical equipment that is needed to aid a woman in labor. Phones enable the process of pregnancy and labor to go much more smoothly and successfully. They create communication between the woman and their doctors. For instance, healthcare workers in the rural district of Mwanzi have been given free phones so they can keep track of all the pregnant women in their villages. This allows the women to text their doctors to let them know how their pregnancy is going, and it allows them to ask any questions that they have. It also enables healthcare professionals to track a woman's progress from her first trimester to her last. Volunteers are automatically reminded to send in monthly checkups, and if a doctor spots any problems, they can send a text urging the mother to get to a clinic. Now that they have cell phones, women are able to call for an ambulance if they need it. Before they had their phones, it took at least an hour to get help. Now after sending a text, they get feedback, and in 10 minutes an ambulance comes. The cell phone really helps make a difference, because even when the districts had their own ambulances, the number of maternal deaths did not decrease. The people had no way of communicating when they needed an ambulance. Now that they have cell phones, that is possible. The number of maternal deaths significantly decreased because of this. They have not recorded a single maternal death in Amansi village since 2006 when the project began. The cell phone allows for improved communication between doctors and their patients. This is a perfect example of how mobile technology is greatly improving the lives of the African people. With mobile healthcare still rapidly growing, mobile technology is an effective improvement to the healthcare system in Africa. It is making the lives of the African people steadily better.